Hello, it's Medic Echoes yet again, bringing you all there is about health. Today we'll be talking specifically about the increasing rate of stroke among young people. When one talk of stroke, for many, it is predominantly believed to be more in older adults. However, recent data have demonstrated significant rise in the number of young people below the age of 40, 45 coming down with the disease.
Basically, there are two types of stroke, the ischemic and the hemorrhagic stroke. Now, the ischemic stroke is by far the commonest type of stroke, accounting for about 80% of all stroke. It occurs when artery blocking blood clots travels to the brain. On the other hand, the hemorrhagic stroke is less common and occurs when blood vessels in or around the brain ruptures.
On the causes of stroke, well, there are many risk factors that can increase one's chance of developing stroke. There are smoking, heavy consumption of alcohol, diabetes, hypertension, high level of cholesterol. Although this factor holds true for both the young and the old, but the most likely to cause stroke in younger people as follows.
Heart conditions that predispose to cardioembolic stroke, such as arrhythmias, congenital structural defects of the heart, valvular diseases, aneurysms, which can form when a wall of the blood vessel bursts open, causing hemorrhagic stroke.
Hematological or blood disorders, inherited conditions which predispose to blood clot, for example, antitrophin 3 deficiency, sickle cell anemia, among others, and also kidney diseases, for example, polycystic kidney disease, which can be hereditary.
Dissection. This can result from trauma and connective tissue disorder. Pregnancy. This increases the coagulability of blood by increasing the amount of clotting factors.
Certain drugs or medication, whether prescribed or illicit, have been noted to be a risk factor for the development of stroke. Example of such drug is cocaine. There are many others. Is there a need for concern? Yes, of course there is. Because aside the risk factors for developing stroke, young people generally have been known to take their health less seriously.
Young people are less likely to accept the diagnosis of illnesses such as hypertension, diabetes, and other chronic diseases.
Young people are less likely to turn up for follow up and often believe because they are young, they cannot be sick of certain illness.
The way forward: weight measurement. Knowing what your weight is and taking appropriate lifestyle changes can help prevent possible overweight and obesity.
Routine blood pressure checks to ensure it's within normal range and taking appropriate action by seeing a doctor when noted to be high.
Encouraging a healthy lifestyle, such as regular exercise, cutting off or reducing alcohol intake, cessation of smoking, having quality sleep, and eating healthy have been shown to improve our general well being.
Getting the needed vaccination is key to preventing many illnesses, especially the infectious diseases.
The rate of stroke among young people would drop dramatically if everyone can be more in control of their health.
Just anybody can get sick, young or old. Take charge of your health by living right.
Anybody can get sick, young or old. Take charge of your health by living right.
Anybody can get sick, old or young. Take charge of your health by living right.
Anybody can get sick, both young and old. Take charge of your health by living right.
Anybody can get sick, young or old. Take charge of your health by living healthy.